Good afternoon. My name is Michelle O'Keery. I am the CEO of Compassion House Foundation, and I want to say thank you for joining us for our Inspiring Speaker Series event today on the benefits of exercise during the cancer journey. I'd like to start by acknowledging that we are on Treaty 6 territory, the traditional meeting grounds and homes of many Indigenous peoples, including the Cree, DeSoto, Blackfoot, Métis, Nakota, and Nakota Sioux peoples. Many people think that treaty rights are special Indigenous rights. However, all people living in Canada are treaty people with their own sets of rights and responsibilities. Treaties are a foundational part of Canadian society, and every road, house, building, or business that exists today in a treaty area was made possible because of a treaty. June is Indigenous History Month, and in light of the recent bodies found at residential schools across our country, including the most recent and significant one that was just announced earlier today in Saskatchewan of 751 at Cowessess First Nation, not far from where I grew up, and where my grandmother actually attended a residential school. I would like to challenge each of you to take some time to read and learn about Canada's history. I'm a little bit emotional about that, so I apologize. But for the next hour, we are going to focus on the benefits of exercise through the cancer journey, and we do have Chris Sellar from the Alberta Cancer Exercise study here with us today to share how research supports the benefits of exercise to improve symptoms related to cancer at every stage of treatment and recovery, along with Tiffany Blake, a past guest of Sorrentino's Compassion House, who will share the impact that exercise had on her cancer journey. I'll turn it over to them shortly. Chris will present, and then Tiffany, and we'll have some time at the end for Q&A. But before we start, I'd also like to acknowledge that this event would not be possible without our sponsor, CPA Alberta. CPA Alberta has been a longtime supporter of the foundation, and their sponsorship of this event is really appreciated. So thank you to CPA. Now, without further ado, I'd like to turn it over to Chris, and I will mute myself.
Oops. Okay. Hopefully everybody can see the PowerPoint okay. So I first want to thank Michelle and Compassion House for the invitation to speak today. I'm obviously a little bit biased, but I think there's a lot of good things to talk about related to exercise and the potential benefits for cancer survivors. But we also have Tiffany here, and I want to don't cut in her time because I think it's better to hear from somebody that's actually lived the experience than just a researcher talking about what the evidence says, but I will quickly try to highlight that. And just before I go further, whenever I use the term cancer survivorship, I use one of the common definitions of that is that anybody from the point of diagnosis for the balance of life. So when I use the term cancer survivor, that's kind of what I'm referring to. So I'm going to talk just a bit about that as far as setting the stage for why exercise and being active might be an important part of that cancer survivorship after diagnosis. I'll highlight briefly what the research suggests are kind of the key benefits that are unique wherever I can with the unique benefits of exercise for cancer. I think we generally all know exercise is good, but why specifically for cancer survivors is beneficial. Again, that'll be very general, but some tips on what do we recommend as far as how much exercise and the types you might want to be doing for cancer survivors, and how some tips to kind of get started. And related to that, I'll finish off with just talking about some of the research that we have going on here in Alberta and even beyond that kind of provides some support for people that are looking to get started with exercise. So a very busy slide, so I apologize for all the words, and I'm not going to go through each side effects, but I just wanted to highlight some of the common side effects that we see reported amongst cancer survivors, definitely amongst the people in our exercise program. Obviously, it depends on the type of cancer you're diagnosed with, the stage, whether you're on or off treatment and what treatments you're receiving. Even two people that have the same diagnosis and same treatments might experience side effects very differently. But I just wanted to highlight some of these and kind of a spoiler alert. But these are some of the side effects that are common and also that we hope we might be able to improve or prevent or lessen through exercise interventions. And I also want to highlight cancer-related fatigue because over 90% of our participants in our programs report this fatigue from their treatment and from their disease and its treatments. So regardless of diagnosis, that's one side effect that we see across our participants that we hope we can improve through exercise. And obviously treatments are very important, but because of these side effects that come with them and the effects of the disease, as far as in the exercise world, for things that I would measure as far as a fitness test, everything I measure can unfortunately be negatively impacted. So people lose endurance, they lose strength, they lose balance, they lose flexibility. Again, it varies on the type of cancer and the treatments, but all these things can be negatively affected. Body composition, so people can put on fat, lose muscle, bone can be impacted. And with that, often, and just generally feeling unwell, physical activity participation tends to go down during treatment. And unfortunately, what we find is it doesn't really kind of go back after treatment because of these side effects persisting. So with fitness going down, activity participation going down, it can ultimately be a downward spiral, unfortunately, and affect physical functioning. So it might actually impact people's ability to carry out their activities of daily living, things they want to do and enjoy with their friends and families, and just things that kind of need to get done as far as work or around the house. And unfortunately, this can have that negative impact on quality of life. But to get to the more positive, so obviously we have better screening, better detection, better treatment. So cancer survivorship, people are living longer, but because we have a high prevalence, so 1 in 2 Canadians now are likely to develop cancer in their lifetime. We have an aging population and older adults are more likely to get cancer. We have this large and growing population of cancer survivors in Canada. And with those side effects, there's a greater need for these people to live a better life after cancer. So we really need these supportive care interventions to help people deal with these side effects after their diagnosis. So thankfully, again, kind of a spoiler on the previous slide, exercise has the potential to help a lot of these negative impacts of cancer and its treatments. So, and I'll use the term physical activity and exercise. So just to distinguish the two, when we use physical activity is a very generic term that just means any activity that you're doing that is getting your metabolic rate up. So your heart rate's up, you're burning more calories, just kind of a general term of moving, really, when we think about it. So when we think of physical activity over cancer control, so when we think of the burden of cancer from prevention all the way to the end of life, and I won't spend much, I really don't have time to talk about this part, but it is important to note that people that are more active have a lower risk of developing a number of cancers. So, but today we're going to focus on the post-diagnostic side, and physical activity can be an important part of reducing the burden of cancer from the time of diagnosis all the way to the end of life. So what that exercise is and the goal, or the activity is, and what the goal of it is might be different depending if I'm on treatment, off treatment, in palliative care. So that what an exercise is could be very different at those stages, but it can still be beneficial at any time point for somebody to be active. And when we think about being physically active, some exciting news. This article is about 5 years old, just kind of summarizing the growing evidence. But about 10 years ago, studies started to come out where they showed people that were physically active compared to those that had low activity or were actually sedentary, completely inactive. Those people that were highly active were actually having less recurrence of their cancer, less people were dying from their cancer, and they're actually dying less from other causes. So it's always, I'm again obviously biased, but I think exercise is important because it can help a whole number of things. So a lot of our other common chronic conditions like heart disease and diabetes, being active will also help prevent those, or if you have those, manage those diseases. So being active has the potential to actually reduce the risk of dying or having a recurrence of your cancer, but also from dying other causes. Currently, this research has been shown mostly in our most common cancers, so amongst men and women, so breast, colorectal, and prostate. But we hope as the evidence continues to grow and this continues to be looked at, that we can show that being physically active can improve survival for people of any cancer diagnosis. And now to contrast physical activity with exercise. So when we specifically talk about the word exercise, now we're talking about intentional physical activity. So I'm actually planning and structuring my physical activity over time to try to improve my fitness or another outcome of interest. So this next research is from studies where they've actually put cancer survivors in exercise programs and measure these outcomes before and after the program. So sometimes we automatically, and I know I get caught doing this sometimes, I'm in the exercise world, we think about the physical changes that happen with exercise. So when we do have cancer survivors complete exercise programs, we do see similar improvements to somebody in the general population. So we see improvements in that aerobic fitness. So the endurance tends to goes up. We see improvements in muscular strength and flexibility and balance. Body composition, again, is always one that people really tend to, they see a number on the scale, it's something they really want to improve. And it can, so we can lose fat, we can gain muscle, we can improve our bone density, which can be very important in certain types of cancer and with certain treatments. But those body composition changes are definitely the ones that take that long-term commitment as far as exercise. Some of the other ones can happen in a shorter period of time, like months, but changes in body composition tend to be take longer to see those improvements. And I've also made the point again that obviously you might seem like a no-brainer. If I'm in an exercise program, of course, my physical activity participation goes up. But again, this is important because if we're more active, again, there's the potential that we might actually be reducing our risk of having a recurrence or having that cancer or dying from that cancer. And then there's also our patient-reported outcomes. So again, thinking away from the physical, more on that psychological and mental side, there can definitely be a lot of benefits from participating in exercise. So improvements in our overall quality of life, help with symptoms around anxiety, depression, and stress that can often come with a diagnosis and treatment. So we also have a lot of those mental, psychological aspects that we hope that we can impact by having people complete exercise. And then specifically related to disease and treatments, again, this will depend on your diagnosis and the treatments you receive. But again, that cancer-related fatigue that over 90% of people say that is an issue for them. Exercise is one of the interventions that's been shown time and time again, and we see this in our programs of really actually reducing that fatigue and improving energy levels after cancer and its treatments. Lymphedema, particularly in breast cancer for women that have had surgery on one side and have swelling in that arm, resistance training specifically has been shown to help with that, unfortunately common side effect. And overall, people tend to report a lower symptom burden if they're active during and after treatments. And then just some more specific reasons. So I talked about all those side effects at the beginning, kind of starting on a bit of a sour note, but again, exercise, the right type and progression of exercise can help reduce. It might slow the progression of a side effect, completely prevent a long-term effect from happening, or lessen the impact on the individual. So that's, again, we hope that we can impact a lot of these side effects through exercise programming. For people that are on treatment, some people that have been active before and or during their treatment, they've actually shown that they can tolerate treatments a bit better. So might be able to hit that cancer a little bit harder by being able to tolerate more or all of the planned treatments. And some people we know are off treatment now, but it might be that they'll be cycling on and off treatment over the course of their life or when a new treatment comes up. So the more in better shape you are, the more likely you're going to be eligible for that new treatment and be able to tolerate it once it comes. And like I said, it's important to highlight there's that potential to reduce a recurrence of cancer. And unfortunately, cancer survivors are also at greater risk for having another cancer compared to somebody in the general population. So again, there's that prevention aspect where being active might reduce your chance of getting that another cancer. And good things that have also come out. So there's lots of these benefits, but also it's been shown that exercise is feasible and safe for people that are going through cancer treatments or after. So that's important to know that we're not causing a bunch of issues by having somebody exercise while they're also receiving treatment or recovering from it. So it's important to note that it is safe, just like we would see generally in the regular population. Exercise is a safe thing to do. People on treatment can experience benefits, but when you're combating the side effects of treatments, often they might not be as great as the benefits that we see after continuing exercise after treatments are completed. So it's important to know you're helping your body, but you might not see it on the numbers or that sort of thing if you're exercising during treatment. And unfortunately, despite many of these benefits that we know about, we know that many cancer survivors are not active. And this isn't to say that cancer survivors are lazy. That's definitely, in my experience, the exact opposite. I think generally the people I come across are very motivated to do something they're in control of to improve their health. But because of those side effects that can linger on well after treatment, there's a lot of barriers, unfortunately, to participating in exercise. So a big part of what the work I do is to try to help people get active. And on that note, just kind of, again, it's very generic, but it's an important starting point of what should we actually be doing, starting with, or targeting, or trying to do as far as exercise for people that are not exercising, they never have, or they're trying to get back to where they were before their diagnosis. So the big thing, and this is important for all of us, particularly during COVID when we're on Zoom a lot, I know I am, is just generally avoiding inactivity. So more and more our public health guidelines for exercise are including this. Not only are we talking about exercise, we're also talking about avoiding sitting and that sedentary time, screen time. So avoiding inactivity, moving any amount for any amount of time is better than not moving at all. And these are our public health guidelines. And what we find is our guidelines for cancer survivors are very much the same as far as our targets for the general population. There's obviously some precautions and caveats that I'll talk about, but our overall target is ultimately the same. And these numbers are targets, they're goals. They're not necessarily a starting point depending where you're at. But ultimately, we hope to do about 150 minutes of moderate aerobic exercise per week. So that's about 30 minutes, 5 times a week if possible. It can, again, be broken down into smaller chunks on more days, but that's a good target to reach for. And when we talk about moderate, this is like a brisk walk. So my heart rate and breathing's going up a bit. I might be getting a bit warm, even sweating a little bit, but I could still talk if I was walking alongside somebody. Not sing, but you could still talk. Vigorous exercise, higher risk of injury, and you have to be careful, particularly on treatments or if you're having symptoms, but they kind of count for 2 to 1 minute. So I can get away with half the amount of vigorous exercise compared to moderate. So you can see the goal is 75 minutes. Vigorous, now we're talking about compared to brisk walking, now we're jogging or running. So definitely breathing heavier, definitely the heart rate's going up a bit more. Now, if I'm going to talk to the person beside me, I kind of have to think about getting words out between breaths. And at this point, you should definitely be getting your glow on and sweating a bit. And then on top of that aerobic, we recommend whole body exercise resistance routine to try to hit all the major muscle groups in the body. But again, important to note, again, these are targets. These are things to strive towards. As long as you're not experiencing pain or too much fatigue, more exercise generally will be better. But initially, particularly during treatments, when you're battling those side effects, smaller amounts spread out over more times during the day are still, like I say, any kind of movement is better than not moving at all. So don't get caught up trying to hit these targets in week 1. These are things that you want to slowly build towards. And just a kind of a quote from our general guidelines is that definitely on treatment, we see more need to modify exercise, doing those smaller amounts, doing lower intensities, but just again, trying to maintain as much activity as possible. And more, what we're seeing in the medical world and the research world, and definitely what I do, exercise is becoming a very crucial part of managing those side effects and helping those cancer survivors thrive in their survivorship. But like I said, the actual targets are pretty much the same as far as public health guidelines for how much activity we should be doing. Definitely some precautions. A lot of these precautions that we see here are actually matched up with some of the side effects I talked about. So sometimes, depending on the cancer, they might be more prevalent during treatment and hopefully lessening as we go along. Some of these will be permanent, but again, things to talk about with your healthcare team or rehab team or your exercise professional you might be working with. But these are things to consider and build into your exercise plan that you might need to work around or do a little bit less so that we're not making these symptoms worse. And these are things just like on the day, and they apply to cancer survivors, but they apply to anybody. If your pulse is racing before you even start moving, you want to stop. You know, if you have a fever, any kind of pain, and I want to hit that point right now, the whole old school, no pain, no gain, is not how you should be moving. So I stole it from one of our ACE instructors, but we use the saying, all gain, no pain. So you should feel your body working and joints moving, muscles pulling and working, but there shouldn't actually be pain when you're moving. If there's pain, that means you're doing a bit too much and or the wrong movement. So definitely important to avoid that. So again, if you're nauseated when you're exercising, confused, disoriented, dizzy, these automatically mean you should stop. If you're experiencing these beforehand, you shouldn't even start. And so generally just people being on treatment or recovering from treatment and having that cancer diagnosis, you're going to be at a bit of a higher risk for injury with exercise or other adverse effects. So you just need to approach it with a bit more caution. If you're still in touch with your healthcare team around your cancer, great to run it by them and see if they have any specific limitation or advice. in doing that exercise. Your family doctor, again, or a therapist that you might be physio that you might be working with outside of cancer should be able to help you along that as well. In the exercise world, if you're looking for certain certifications, our Canadian Society of Exercise Physiology is the governing body in Canada. So if you see people with, we call it CSEP certifications, that's good. Here in Alberta, the Provincial Fitness Unit provides provincial certifications. So again, these organizations make sure people have a good combination of educational background and practical experience to kind of help you through your journey. The American College of Sports Medicine is a larger body across North America and the world, and they also offer a cancer-specific training. Important thing to note is you want to be cautious, but if you approach it in the right way, the benefits of exercise are far going to outweigh the risks. And just some, again, general tips to get started. For most of us, low intensity walking is a great entry point if you're not active or just getting back to it, as long as you're able to walk. If you have trouble ambulating or bearing weights, if you can get on a bike or like a recumbent bike, a seated bike where you don't have to worry about your balance, that might be a good way to start. If pools open up again after COVID, if you're okay getting in the water, that can be a very safe environment to move in because your body weight's supported. But generally that's kind of an entry point where you don't need a lot of advice to get going. If you're still having symptoms or you want to do more exercise than you have been doing over the last while, again, if you are still in touch with your healthcare providers around your cancer, great to run it by them. If you have specific side effects, if you can see the rehab department, like at the cancer center or in the community, you might want some specific advice to help with that issue, to provide exercises that are going to help that specific issue, or they might tell you things you want to avoid to not make that worse. So those are good discussions you have. And if you have the resources, so they aren't cheap necessarily, but someone like a personal trainer that's qualified can be a good resource to help you as far as assessing where you're at, designing a program, and checking in to see if you're progressing accordingly. So take-home messages: exercise is safe, but it's still good to touch base with your healthcare team other than that kind of general walking if you want to do more. Again, exercise professionals in the community, more people, part of what we're doing is helping to hopefully train people in the community to work with cancer survivors, because it's a growing segment, as I said, of our population. Rehab professionals can be very helpful in those specific issues that you might be experiencing during and after your treatment. But overall, exercise has many benefits, physical and psychological, potentially impacting disease outcomes as well and treatment-related factors. So if you aren't already exercising, you want to try to start moving as soon as possible. Am I doing okay for time? Sorry, Michelle. Okay, so I do want to take a bit of time. So ACE, everything in the research world has to have a fancy acronym to sound good and important, but ACE stands for the Alberta Cancer Exercise Program. So it's a research study I've been working on for over the last 5 years. So again, acknowledging funders, Alberta Innovates and the Alberta Cancer Foundation have given us funds to keep this program going. It's a 5-year study, and we're really looking at trying to implement all this great knowledge. We have all these benefits. We know cancer survivors aren't as active as they need to be. So we're trying to get a community-based program going and actually ultimately make it part of cancer care to offer exercise programs to cancer survivors across the province. So the pictures are obviously pre-COVID, as the little disclaimer says on a lot of things these days. But this is kind of what our programming looks like. So it's a 12-week exercise program. We do a fitness assessments and questionnaires to get it. Are we changing anything before and after the program? Over those 12 weeks, people exercise 2 times a week for 1-hour classes. In pre-COVID days, depending what site you went to, we would offer circuit training. So it's kind of a 1-hour group fitness class. So you see that on the left of the screen. And this is what our virtual programming, when we shifted from COVID, everything's been offered via Zoom, looks a bit more like our circuit training. Wellspring here in Edmonton in our lab at the University of Alberta, we would do more of the group personal training. So kind of like a gym workout where you'd warm up on a treadmill or a bike or elliptical machine, then do a full body routine of resistance training using free weights and machines, and then finishing off with some core work, balance, and flexibility. So that's kind of the programming, what it looked like. What we've seen overall, on average, people are improving those physical fitness outcomes. So they're getting more endurance, getting stronger, better at the plank, being more flexible, all these good things, better balance. And as well, we're seeing those improvements in that cancer-related fatigue, health-related quality of life. So we're seeing those positive psychological and mental psychosocial benefits as well. And overall, people are adhering to the program. They're finishing it. So we see that as a good sign. It must be having benefit. And overall, when we ask for feedback, we're getting very high program satisfaction. And we did build a program. We had focus groups initially to make sure that it was patient focused and informed. So we tried to offer a program, what cancer survivors told us they wanted to see, as opposed to trying to, as researchers, trying to force something onto people that wasn't really matching their needs. And with that, so it is an Alberta program. So we have a Calgary team that's led programs in Calgary in the southern part of the province. And they were lucky enough and worked hard enough to get another grant from the Canadian Institute of Health Research and the Canadian Cancer Society. And provincially, the Alberta Cancer Foundation kicked in some money as well. So again, another acronym, EXCEL, which stands for Exercise for Cancer to Enhance Living Well. It is also in Nova Scotia, Ontario, BC, Saskatchewan. So they're really trying to offer programs where there are no existing programs. But here in Alberta, we're basically building on ACE. We've been in our main cities and in our regional cancer centers. We're really trying to take that programming now and deliver it in more rural and remote areas. So again, virtually with COVID, this study is just starting, but that's kind of two options. So for anybody, again, that's looking to get into exercise, and if you remember one of the contact points, if you contact either lab, we're both involved with both studies, so we can direct you to what might be the more appropriate study depending on your location and where you're at. But definitely these are programs. We're just finishing our spring programs, unfortunately, and we take the summer off because people don't want to be stuck on Zoom or in gyms in the summer. They want to get out inside and enjoy it. But definitely these programs will be, not sure exactly what they'll look like. We're hoping for some in-person programming, but we'll be up running again in the fall to get help cancer survivors start moving come September. So sorry, hopefully I didn't take too long. Thanks for your time, and nice to hear the research evidence, but I look forward to hearing Tiffany's personal experience firsthand of her journey.
Thank you so much, Chris. That was incredible and so much information, and hopefully you'll be willing to share those slides with us. Perfect. Yeah, so I can send them out.
I know it's a lot to look at.
No, it was so good, and I know we've worked with you before. Chris actually has a publication on our website under Compassion Connect. So if anyone's interested in some additional information there, great partner for us as an organization. I'm sure there are a lot of questions that came from that. So if anybody has them, we're going to hold off until after Tiffany presents. But if you want to put them in the chat or in the Q&A function, we'll hang on to those and we'll come around to it at the end. And now I want to pass it over to Tiffany to share her experience.
Hi, thanks, Michelle. And I'd like to thank the sponsor of the Inspiring Speaker Series for inviting me to share my story today. Chris, wonderful information. I think we all know that exercise is good for us. Even though we know it's good, I don't think we always necessarily do what we should be doing. But what I hope you take away from my story and what I've learned on exercise is how it should be a component to treatment, post-treatment, and going forward every day. So just a bit about myself. I'm from Fort McMurray. I've been in Fort McMurray for 18 years. I've raised 2 children. My daughter is currently a paramedic and my son is a welder. I work for one of the oil sands mining operations as a safety advisor here in Fort McMurray. Prior to my cancer diagnosis, formal exercise was not part of my daily routine. I do get out in the field, I get to walk around. If it's raining, I don't go outside. If it's cold, I try not to go outside. So really not an ongoing formal exercise program. That changed in May of 2020 when I got my cancer diagnosis. I got a diagnosis of a stage 3 cervical with pelvic and abdominal node involvement. My treatment protocol was going to be, or was, 25 external radiation, 58 hours internal radiation with 5 cycles of chemotherapy over 6 weeks. So my relationship with exercise started when I was diagnosed. I started working with a personal trainer through one-on-one online coaching. And then I also enrolled in a 6-week group session. For my one-on-one, we talked about goals. So a lot of the goals that my coach, my personal trainer, works with people are for fat loss. My goal was to ensure my headspace was where I needed it to be during treatment, and anxiety. I was really worried about the chemotherapy and the anxiety that I was starting to have with that. And then the other thing that we worked with is learning to listen to my body and what it was experiencing, because we've worked in stressful situations, personal life situations where you just push through and you sometimes don't necessarily listen. And for me to heal and to get through the cancer treatment, I really needed to learn to listen to my body. The group session, it wasn't about cancer. It was more of a community with people focused on, meeting their goals, exercising. It was a huge cheerleading group for me. Victories were celebrated. When there were struggles, there was encouragement. And the other part of the group is it brought normalcy during my treatment. With COVID and not being able to have anybody with us during that treatment process, the connection to the outside world through exercise was really important for me to, mentally feel good. During treatment, we went in with the plan and the goals to walk every day, where Compassion House is in relation to the cross it's a great walk on a nice, beautiful summer day. So that was my goal, is to get walking in. There's a wonderful exercise room in Compassion House. It's got treadmills, you can do yoga. I really wanted to make use of that. What I wasn't prepared for was just how hard the treatments were going to be physically. I wasn't able to walk. So that goal of 8,000 steps, I was lucky to hit 800 steps a day. So with that group, the encouragement came is, what can you do during treatment to feel good? We need to shower every day. So when you're in the shower, stretch your arms, bend side to side, because the shower felt good. And if if you were feeling a little ill and you didn't get it all over your exercise equipment. So that was a really good one. And the other goals is you brushed your teeth, you got dressed. When you're getting dressed, do your stretches. So during treatment, it is a very fluid exercise plan, if you will. And I think you really have to listen to your body and go through with your body and not push it, but work with it through your treatment journey. I finished treatment August last year. It was about 6 weeks until I started to feel good again. The radiation really affected my digestion and being able to use the washroom. So just small walks around the block really helped with that healing process. I do believe that the post-treatment exercise program, my goal was to hit it hard and as Chris showed, the 150 minutes a week, the reality is I couldn't do that. The reality was it's not a one size fit all. You have to fit it for what your body can do as you're healing post-treatment. The residual side effects from radiation for me were a lot worse. The fatigue, the pain in the hips, and just learning what movement helped. So stretching really felt good. The exercise bike, the stationary bike, also so much better than walking. It didn't hurt my hips or my lower back. And then about 6-8 weeks after post-treatment, I had to start some new medications, and the side effects from the medications were the menopause, instant menopause, hormone replacement therapy I was put on, and pain control meds. And I found with the pain control, I had no desire to want to exercise. So being involved with your care team is really important because you can reach out, and we actually found a way that I'm not on pain meds, just the walking and diet is a huge part of it as well. But I was able to control the pain by actually moving, which is not for everybody, but if it is an opportunity for you to look at, I really suggest you do. Hormone replacement therapy isn't for everybody, again, personal choice. But the exercise helps with the hot flash. It helps with the insomnia and not being able to sleep. And the exercise has helped me return to my regular life programming, if you will. I went back to work full-time mid-November, so just 3 months after treatment. There was fatigue in building back up and using your cognitive functions again and in interacting with folks. And the exercise post-treatment, I'm learning to trust my body. I really didn't trust my body when I was diagnosed. I didn't like my body, not for size, shape, but that my body made me sick. And exercise is helping me get through that mindset that I can trust my body. When you feel something that's not right, think about it. Did I move the wrong way? And just really being in tune with yourself. And the exercise has helped me with that through the cancer journey. And like I said, I am not an exercise, I wouldn't say fan. It's not something that, I just wake up at 4:30 in the morning and look forward to riding an exercise bike. So I had to find strategies to really enjoy the exercise that I'm doing. And it's not one program doesn't fit all. It's using a combination of things that you enjoy. Some weeks I really enjoy lifting weights, and there are some days where my hands are so sore and I just don't want to hold anything. So I really switched it up for how I'm feeling. Set achievable goals. I had wanted to get up to 15,000 steps because that was going to make me healthy and that was going to keep cancer at bay. Not achievable goals mean you're not, for me, I didn't do anything. I really fell into just sort of a slump. So setting achievable goals, I'm going to hit 5,000 steps. And when I set achievable goals, I was able to surpass them, which then made me feel better and wanted to exercise more. I increased my non-exercise activity. So I have a standing desk at work now. I take the stairs. I park when we're allowed to go into grocery stores. I park far away. So the non-exercise activity has been it's been helpful as well. And then sleep. Sleep for me, if I get a good night's sleep, I'm more likely to do that 10, 20, 30-minute exercise program the next day. And all of that's just helped me manage my cancer stress. And managing that stress is really beneficial to continue with the exercise programs, right? And then I'm not sure how many folks are on social media, but I did list a couple of my favorites that I really enjoy. Fit Girls Rock Melissa and Stephanie Colstein. Melissa's a coach and Steph is actually from South Carolina. She's a breast cancer survivor and just really fun to watch her on Instagram. And I don't have her listed here, but our own Michelle actually is quite the exercise guru and is really able to, if you watch some of her videos, you can pick up a few pointers and learn how to do some nice weightlifting as well. So thank you for your time.
Thank you so much for sharing that. And I think you hit like so many of the questions that were asked just as we went. I think there was a couple of questions about staying active back at work, and you have a couple of those here, right? And how to stay motivated, like touching on the importance of setting realistic goals. I think that is so important, like for anyone who's getting into fitness, because if you decide you're going to run a marathon, the first run you're going to be isn't going to be the full marathon, right? So like building up and building your capacity is so key. So I love that you hit on so many of those pieces. And Also the benefits beyond kind of the physical pieces, like the impact of exercise on your kind of emotional well-being and mental health, right? And sometimes those are the things that people don't think about. They think about, you know, changing the way that your body looks or different things like that, right? So I loved that you hit all of that. Quick question from the panel, or for the panelists. What does your research show on why exercises decreases the chance of a cancer recurrence? Chris.
And that's the part that's less understood. I mean, like the research that's been done at that point, they send the surveys out to like tens of thousands of cancer survivors and get them to self-report how much activity they're doing. And then they follow them to see what the outcomes are as far as their cancer. Part of it is some of the more general benefits that I don't have time to get into with exercise, things like your immune system. If you're regular physically active doing exercise, your immune system is going to be functioning better. So maybe catching a cancer growth or spread before it like takes hold and causes a number of tumor or advances. You know, hormone therapy came up, and so sometimes a lot of people on treatments, their hormones are being managed by the drugs that they're taking. But exercise can have some similar effects to some of those drugs, where the hormones are actually promoting tumor growth. And because you're exercising, you're kind of taking those hormones out of circulation that might be promoting the growth. So that's another theory. Things like, put me on the spot, that's a really good question. I haven't answered this one in a while. And just also like from a weight management perspective, again, it's not easy to lose weight with exercise alone. Diet's obviously a huge part of that. But the more and more they're finding out about fat tissue, is it releases a lot of messengers in the body that promote growth in cells. So by reducing the fat in your body is another, in theory, one of the benefits of why we would, why it's important to exercise. So those are some of the bigger ones for sure.
Awesome. Thanks so much for sharing that, Chris. I guess I have a question, I guess, for Tiffany. Like, what was your experience, I guess, understanding that you're going through that, through kind of the COVID-19 pandemic? It sounds like you did have access to a personal trainer, which was awesome. So the gyms were open and some of that group setting. But then when things shut down, how were you able to kind of shift and focus on exercise and kind of keeping that up in a new environment where, you know, our gyms were closed and you didn't have the opportunity to go in and be with a group and cheer each other on?
Yeah, actually, none of my group session was in person. It was all Facebook, social media, Zoom, text messaging each other. Yeah, so that's just having that group of people that, you know, we all had our different reasons for exercising, but that cheerleading group, that group that kept saying, keep going, you know, even if you don't feel like doing this, try this. Yeah.
That I think there's also like that bit of accountability too, right? That you know, so they're working out that day, it kind of challenges you too, or you're cheering one another on, and you don't want to let somebody down or whatever it might be. So I love that idea of having a group or a buddy or someone to kind of be there and with you through that process. So awesome. I saw somebody put up their hand, which I actually didn't know was a function you could do in this, but they have it written in the chat. So if you put up your hand and you have a question, please throw it in the chat box and I will read it out. But I haven't seen it come through. You guys were both incredibly amazing, shared so many awesome tips. I wish that before I got into like CrossFit and weightlifting that I would have seen Chris's tips for like, if you feel fatigued or like, if you're disoriented, you should probably stop. Yeah, that's not what they teach in CrossFit. They're like, just push through. If you throw up, like, it's fine. Just jump over it and do another burpee. I had a lot of injuries. I don't do it anymore. But no, that was all unbelievable and amazing. I do have a couple of questions actually just quickly in here. How do you find an online personal trainer? What was your experience there, Tiffany?
So Fort McMurray is a small community, and I was able to find Melissa through people that I worked with, and actually a neighbor of mine had used her as a personal coach prior. So for me, it was really important that the person I worked with came with good references, and we clicked when I talked to her that first time on the phone. We just clicked. So it's really important that you click with the people you're going to work with on your care team as well.
Awesome. And Chris, I know you had some information up for people if they wanted to get connected with ACE.
Yeah, so I mean, that's definitely, you know, it's no cost to you. So to you as a participant, so it can be a good way to start, not saying our program's the be all end all, but definitely you're looking for that support initially. It's not a bad way to get going. And just on the personal trainer note, in our field, unfortunately, personal trainer is not a protected term. Anybody can call themselves a personal trainer, and they might have taken a weekend course, they might have just exercised in the past, or they might have multiple degrees and certifications. So like I mentioned, the Canadian Society of Exercise Physiology, the Alberta Fitness Lifestyle and Coaching Association, AFLCA, is the provincial fitness unit. The American College of Sports Medicine offers an actual exercise and cancer designation now. And our partners in Calgary have what's called Thrive training. So all of our ACE instructors and Excel instructors have completed that Thrive training, and people outside of the study can pay to take it as well, as far as exercise professionals. So those are things to look for. Like Tiffany said, your relationship, just that openness and comfort level is very important, but it's also just something to be wary of in our field, is that anybody could call themselves a personal trainer. So it's good to do a bit of digging to see. Most gyms will let you know once they're open again what qualifications or training their trainers are required to have. It varies from gym to gym, but those are good things to look for as well.
Awesome, thank you so much. Just a couple of comments in here. Love these inspiring presentations. Another great one. Thanks to Chris and Tiffany for your insights and information. Thank you. And from Ron Rhoda, thanks for all the info. I'm from a rural area of High Prairie, Alberta. And I'd love some help that I can get in my area. I'm thinking virtually might be an option for her.
And in the Excel trial, like ACE and Excel have been entirely virtual almost exclusively since last September. So the Excel trial is aimed at people outside of the larger centers. So I know I put that slide up really quick and it went away. So I'll send the presentation to Michelle and it'll be posted, but it has the link for that study. There's no programming right now. They're just finishing up their spring programs as well, but you can contact them and get on a list for, they'll be offering programs again in the fall, and they all will be primarily virtual, almost exclusively. So.
Wonderful. Perfect. Well, I think that's a great note to end on. I will send out those presentations so that everybody has a copy of them. We ask people to participate in a survey afterwards just to give us feedback on how these are going, what other topics they'd like to see us take on. So if you can fill that out, it really helps to kind of fill out our agenda moving forward. I want to say thank you again so much to both Tiffany and Chris for sharing your experience and expertise with us today. This was like such a great and informative presentation. I think people got a lot out of it. I do just really quickly want to plug that we are looking for a couple of volunteers for our casino next week on Monday and Tuesday. If anybody knows somebody in the Edmonton area that wants to take on some volunteer work, it really does help out our organization. The funds that we get through the casino help to keep the house literally like up and running. It covers all of our utility expenses for 2 years, so it's really quite significant. And then secondly, we launched ticket sales for Fashion with Compassion earlier this week. So if you guys want to grab tickets for that, they're $50, and that is a charitable tax deductible. I can't say words right now. You get a charitable tax receipt. So really appreciate everybody's support. Thank you so much for coming out, and thanks again to our incredible speakers. You guys were wonderful. Thank you.
Thanks for the opportunity.